AskReddit by Maya Memasab. Therapists of Reddit, what's a dark secret about your work that no one knows? How many parents bring their kids in not realizing, or unwilling to admit, that their parenting is the problem? I went to a psychiatrist exactly once as a child because I had crazy anxiety and stuttering. We never went back because my mom said, and I quote, "I'm not gonna pay to be told I'm a bad mom." Now after 32 years of depression and anxiety meds, I'm starting the process of getting diagnosed for ADHD. I'm grieving what could have been. It can be an incredibly lonely profession. At most jobs you can build rapport with coworkers and clients that have the chance to turn into close friends. But as a private practice therapist, all interactions have a firm wall of ethical boundaries that don't allow for anything beyond the sessions themselves. I used to be a bartender and would frequently have my regulars over to my house for a party or out to drinks. That is just not the reality though for a therapist. Is it possible to open a joint practice? With another similar therapist, or a profession that complements yours? That way you do have co-workers but you can maintain boundaries with patients. I was counseling a 13-year-old girl for anxiety and she reported sexual abuse from her stepdad. I called her mom and told her mother I needed to call Child Protective Services. Turns out that CPS was already aware and the abuse was first reported around the patient's age 7. Mom was aware of the abuse and stayed with her husband anyway. It was a complicated situation, and it wasn't. How could she not do more to protect her daughter? Sorry lady. I'm judging. My brother raped me when I was 14 and he was 16 and my mom knew. Her words? What did you expect me to do? Throw him into the streets? She still doesn't understand why I don't want to talk to him, but respects it. I'm 34 now and still trying to work through the trauma of those years. Parents who don't protect their kids are horrible. It can be so fucking draining and heart-shattering sometimes. I work alongside CPS and not bringing these stories home, not as in telling them, but as in thinking about them, is really hard. My mom used to be the person who would show up with cops and take kids from homes. She only did it for a couple years until it burned her out. She's told me a couple stories but I think she likes to forget it all. Besides hearing about terrible things, there's really no dark secrets I have as a therapist. I would say one thing that people don't realize, or maybe don't consider, is how draining it can be on our own mental health and how much personal work we have to do in order to maintain. Over the years I have worked with other newer therapists or therapists in training and often they don't realize how far they allow their own mental health to decline before they are ready to work on their own past trauma. A lot of codependent people seek out helping fields but will give until they are completely tapped out and then start to resent their clients or personal family members' partners. Laurie Gottlieb has a wonderful book that explains the process of therapy as well as the personal struggles of therapists, and maybe you should talk to someone. Yeah, I think this is what I've been wondering about. Day in day out therapists need to hear about people's problems. And then they gotta deal with their own. And I wonder how they make it work. My first therapist also died by suicide and I wonder if I could have done something to help. Not sure if that is a dark secret, but therapists have quite a high suicidal rate themselves and more of us than you think abuse alcohol. Even my incredibly centered therapist has told me that there are rare days she goes home and crawls in a bottle of wine. It is so much to take on multiple people all day long, almost every day. A part of the process to become a master's level licensed therapist involves many unpaid hours of internship. This is often inaccessible to those without a steady support system and the resources to do unpaid work while working towards a degree. Because you have to work many hours unpaid, this breeds a field ripe for corruption. I have known of many therapist offices agencies who will stack unpaid interns with a massive amount of clients so the supervising therapist can bill insurances for the sessions under their name. While the intern gets paid in experience, the supervising therapist will then collect multiple insurance reimbursements as if they are the ones rendering services. Highly unethical and major fraud. Unfortunately, since you have to have the internship hours, Interns have to go along with it or risk not getting the hours for graduation. Fucked up that the field supposedly most understanding of human emotions still mistreats its employees. Maybe even worse since they are self-aware and do it anyways. A dark secret? There aren't really many. I guess there are some clients we don't have much hope for. Not necessarily the most depressed or the most anxious or anything. Rather the ones with little introspection and a high degree of narcissism that are always telling half-truths. Preach. I've always said to my husband about his siblings that therapy only works if you're being completely honest. It's not if a patient of yours dies, it's when. Even when it's not for suicidal reasons, we deal with so many people that eventually you're just gonna have someone die while in your caseload. The work is also very draining, and while you do eventually grow a thick skin, it's impossible to not feel anything. I was in tears during COVID knowing my patients were sometimes in homeless shelters or on the street while I sat comfortably in my apartment. It was very difficult not feeling some level of guilt, even though I was well aware that the circumstance had nothing to do with me. I ironically experienced the reverse of this in high school. I was seeing the school therapist because I became extremely anxious and depressed and was having suicidal and self-harming thoughts. Right in the middle of it all, the school therapist passed away in their sleep one night. She was a lovely lady. Messed me up even more. My best friend is a therapist for children. She often vents at me about feeling so damn powerless. She has had kids committing suicide. She has had kids willingly enduring sexual abuse so their young siblings aren't next, and they are fighting her, suggesting to report it. She has had children who are neglected from their biological and foster parents and are just desperate for love and connection. She has had kids who were abused so much and so badly that they will be broken forever. She has had kids who have completely given up on life at merely 7 years old. And she says she is so powerless when it comes to helping them. There is the urge of solving the problems, helping the kids and getting them out. But most of the times, she can only help a bit, and not solve their problems. I believe it isn't easy to live with that. Isn't she required to report things like sexual abuse and suicidal ideation and neglect by parents and foster parents? I'm in school to be one, but I'm already working with clients. I have serious concerns about the therapeutic skills of some of my fellow students. I fear they will harm their clients because of their own issues. Unresolved PTSD, subclinical borderline, narcissism. I'm as liberal as they come, but I've got a colleague who can't find it in themselves to express empathy for their conservative clients. On the other hand, one of our professors is explicitly racist. It's a mess. Don't be afraid to shop around. Yes. I remember listening to fellow therapists in training present cases, and the total lack of compassion for people who are not like them was extremely fucked up. I operated at the other end. It was too draining for me to care so much all day long. I applaud anyone who can find and hold that balance. After I completed my practicum, I switched careers. You get to hear horrible stories from things that happen to people in their lives that make you question humanity. In contrast, you get to experience miracles happening in front of your eyes and transformations of lives as a result of that. I like some patients more than others, and I think it's okay as long as it doesn't interfere with my ability to help them and work with them. I did redirect a few patients to other mental health professionals, telling them it would be more adapted regarding their issues. But really it was because I knew in our first session that I couldn't stand them. It happened twice so far. If I can't see any form of light, anything positive in a patient, as shallow as it may be, I can't work with them. That's not shallow at all. You would be doing them a disservice if you kept them. Worked in homelessness, getting folks off the street and into housing. Worked hard for 3 months to get one person a lifetime housing voucher because they were disabled. Vouchers became more streamlined and had bigger opportunity to make a difference for folks. Landlords in my state then started turning away people with vouchers under the logic that they did not earn 3x rent, since the voucher was only for the exact rental amount and utilities. Was a case manager for in-home care. Had a mother of 2 who was the home caregiver for her kids. Paid by the state to give care. Kept the all blinds drawn in the home 24/7. Wouldn't let the kids go out and often rejected medical advice on their behalf. I think it was a case of Munchausen by proxy. Basically the mother convinced them that they are sick, created conditions for them to be unwell, and got paid for it. CPS and medical teams couldn't do anything. Basically the whole system is fucked. Left shortly after. For us therapists, the Patriot Act exception to confidentiality. Since the Patriot Act was passed, the FBI can request records from a therapist. Among other entities, the Patriot Act is insane. The therapist has to provide them and the therapist cannot inform the client that this has happened. Therapists don't always disclose this to clients, because it tends to cause more harm than good. No therapist I know has ever had this happen to them, but it's extremely creepy that it exists. Good therapists write notes in a way that don't disclose information if they are subpoenaed. But it is terrifying that such private documents are open to public scrutiny. I don't know that there are any dark secrets per se. The only thing that comes to mind is when you're coming up against issues with systems, society, CPS, homelessness, inequality in general, etc. It can be hard to treat someone's mental health if their basic needs aren't being met. Mostly, we really just love our patients and want them to succeed and be happy. I genuinely care for all of my patients and think about them all the time. Meeting basic needs is tough at times. The state I worked in had a disgustingly low budget for mental health. Not to mention I busted my ass firsthand working 2 jobs, going to college, and prepping to join the Marines while being homeless because somehow I qualified for nothing. I stayed sober and stable through it all. The system sucks. Very pertinent timing that this post should appear on my feed the day I get accepted into a training course to become a therapist. Thank you so all of the therapists who have shared their experiences. Hey, you should look into internal family systems therapy. It's a really fabulous form of therapy. I've been in it for 3 years now and after many years of flat out refusing to get better, it has made such a difference for me. It is especially beneficial for people with trauma. It's becoming more common, and it's really making a huge difference. Richard Schwartz is the creator-author, and he's written several books about it. It's about 30 years old. Obviously you're just starting out, but this is a really worthwhile type of therapy to learn. Inpatient psychiatric hospitals are often more damaging than helpful, but insurance doesn't care enough to actually pay for quality care. I worked at one and 2 young men were staying in a room together, both extremely psychotic. While one man was sleeping, the other one beat him bloody to the point his eyeball was hanging out. It happened in less than 5 minutes. Every patient is checked on every 15 minutes, and wasn't heard over the sound of the other patients talking, the victim being asleep to begin with. It was only when I saw the roommate walking out covered in blood that staffing noticed. Sad thing was both men were kind, previously successful students, with no prior aggression issues, and the roommate had hallucinated that the victim was trying to murder him, so he thought he was defending himself. This severe of an incident is rare, but smaller situations like this can be common among. Deleted. You have a good point, but part of me wants to be pedantic and say that when the patient does it, it's just transference. That a lot of us struggle with the same issues that our clients do, and sometimes don't do the work that we expect our clients to. Other therapists know this. I could work with the hardest and most disturbing case in the world, but the most challenging and worst part would still be typing up my notes on time and dealing with administrative staff. That the field is vast and tends to have a wide variety of individuals. Some that have entered into the profession to heal themselves but then continue to harm themselves, others. We had to go to school for a very long time and work for free for a year, just to graduate as an associate and have to complete 3 years of supervised work prior to be considered a therapist, usually making pennies during that time. Then we still have to beg and claw insurance companies to pay us while battling clients who no-show us and don't believe we should be paid for our time. All this to say, I love my job and specialty. Biggest secret: we care deeply for our clients' well-being. We go to some dark places ourselves. It's common for people to think they might be judged in therapy by the therapist. Trust me when I say that is the last thing we would ever do. The shame or fear you hold onto is, more than likely, something we've heard thousands of times or experienced personally. Few patients really want to change themselves. There are a lot of people out there who rather want to complain. There is some hope that in the end they stop complaining and work on themselves. Many patients try to reach goals which are far away from therapy. Some of them even want to go on with criminal behavior and use therapy to do so. A mother got their girls back from custody and immediately let them visit the neighbor. If you know what I mean. I'm praying that it wasn't because of seeing a therapist that the judge returned the girls to her. Sorry for my bad English. Thanks for the upvotes. I take it as a sign that I am not condemned. I've been wondering this about myself as well. Am I genuinely seeking help or am I just cribbing about my problems?